What's up, guys? John here. Titan Talk Tuesday. It's official. Tuesday is here. The end of the working day is here too. Thank goodness. So for all you guys out there that are just done with your job and going home or going to work out, I hope you have a good rest of your day and night. Go eat something good. You deserve it. So we've got a lot of good topics today for Titan Talk Tuesday. We're going to talk about our healing package, BPC-157 TB-500. I get a ton of questions about that all the time. T-cell immunity for COVID. We'll talk about that. Anything's possible. I'll give you guys a breakdown of what that means. Walmart, COVID hugger. We'll break down that story for you guys too. So if somebody comes up to you, make sure you guys are on, your head's on a swivel, because you need to have it right now for sure. Always knowing your environment, what's going on. What else we got here? UVC wands, ultraviolet wands. If you guys haven't seen those things are the things that have ultraviolet light that supposedly kill viruses and bacteria. We'll talk about that too. What up, Scott? What up, Pat? How you guys doing? Production, how you doing? Hap Hipster, Cali Victoria, what's going on? Earth, how you doing? So we're about to get on. What's up, Andrew? What's going on, guys? So let's get it on. Let's get this Titan Talk Tuesday rolling and controlling, all right? So the first thing we want to talk about today is our healing package, the Titan Ultimate Healing Package. Now, what does that package have in it? It has BPC-157 and TB-500, or Body Protection Compound, BPC, or Thymosin Beta-4, it's the synthetic version, TB-500. So this is TB-500. Thymosin Beta-4 is the chemical name of the more natural occurrence of peptide in your body, though. So let's get into it. Let's talk about these healing peptides. Now, a lot of people, they get injuries, especially the longer you're on this earth. You might have, some shoulder injuries, knee injuries, ankle injuries, wrist injuries, whatever it may be, ligament, tendon tears, muscle tears. So there's a number of different things. Inflammation in the body, that's another big thing, right? Everybody's got inflammation, want to keep inflammation down. People get all different types of bowel things like IBS, irritable bowel syndrome, right? They might also get a couple different things as far as in the stomach or stomach problems, digestion and such. So let's talk about the first compound. Thank you. I appreciate that, Pat. Got the beer on flesh. It only takes me a couple of days to grow this, man. So, it's getting thick pretty quick. So BPC-157, let's talk about the first compound. Body Protection Compound. This is a protein with 15 base amino acid chain, right? So this sequence is not naturally occurring, but it comes from the gastric juices in the body, in the stomach area. Okay? Now, to use this, you usually want to inject, right? Because usually this is the injection. You can take it orally, but usually injection closest to the injured site because it's more site specific, okay? So at that point, when you inject this, you want to inject this, let's say you have a shoulder injury, subcutaneously to the closest to that area. Now some people can I inject it right in that ligament or tendon? No, don't do that, right? That's the first mistake a lot of people do. Don't do that. Use it subcutaneous, use it correctly. But what is it good for? So I talked about some of the different things that it treats or help treat out there, but it's good for a number of different things too. Joints, tendons, muscles, right? What it does is angiogenesis. It creates more blood vessels and cell migration, all right, through the body, so pushing out. And these new blood vessels help blood get to the injured spot to help heal the area. It's also good for wounds, so wound healing after surgeries. If you've got a nagging knee, you've had those stomach issues, BPC-157 is usually pretty good for a lot of our patients in helping them get over some of these issues, okay? Whether they're chronic issues or they're acute, that means that they're long-term and ongoing, or they've just happened recently and immediately, okay? So the other thing, TB-500, that's the second part of the healing package. These are two different therapies. They work synergistically, so they work together, which is great. You want to get the best effect and best result by using these healing peptides. So they really work almost the same as far as that goes, but TB-500 works systemically through the body. That means you can inject it in the tissues and it goes throughout the body and works completely. Another thing that the body protection compound, BPC-157, they say these things are good for protecting the organs and such, brain tissues at that point. So we know that works good. So TB-500 works synergistically along with it and works in a lot of different ways. The other difference I would say to it is it works on flexible tissue, connecting tissue, right? So that's important, and that's really a good benefit of TB-500 as far as using it for healing factors. It is a naturally occurring peptide as far as in the body and stuff like that, so it's more naturally occurring, I guess, than BPC-157. But they both work pretty darn good. And when I say that is I was a big, I'm like, is this stuff really going to work? Should we really bring this on as a therapy? And this was years ago. So at that point, I had shoulder injuries. I still got shoulder injuries. But I had shoulder injuries at the time. That's when BPC-157 was first getting compounded by the pharmacies, and we were able to give it to patients. So at that point, I'm like, listen, let me use this stuff. Let me see how it works. TB-500 was not available at that point in time, so I had to use this by itself and separately. And when I did, I documented. I have all the videos on social media, so you guys can go back and check these videos. But I basically, healed myself at that point. I did rehabilitation. I did uploading as far as progressive loading and going up in my weight week by week by week, making sure flexibility was there, mobility was there. So I want to make sure that I was good to go, and I didn't need a surgery because I did have an MRI done at that point in time too on the shoulder just to make sure there wasn't a serious tear in there because I didn't want to do more damage than good, right? So on the MRI, it did not show any tear, so I was fine. I actually was really good beforehand, and I was just in a lot of pain. I really couldn't just push 25 pounds. So it was more of a pushing motion than a pulling, right? So when I use this, I got myself back. Now, I've used TB-500 for a number of different things too, along with BPC-157 to try to do maintenance and stuff like that. Now, bad news is I don't use it all year round. I've only used it when I had injuries and stuff like that, or I wanted to be preventative to maybe some of the things I was doing, as far as, like aggressively working out and some of the weight I was going after. But I didn't use it. I haven't used it for probably about 4 or 5 months. I literally got a slap tear. So superior labrum, posterior and anterior, or anterior and posterior, if you want to say it like that, tear. And it's a pretty bad one. It's maybe like stage 3, and there's like 4 stages. So at that point, I'm trying not to have surgery. So I've already had the MRI, which confirms all this stuff and how bad the tear is. So I'm going to do these healing peptides myself again and see if I can get myself back to where I need to be. Without hopefully having to get surgery. And I'm going to have another MRI done. I have the dates on these MRIs so I can show you guys me doing it. But a lot of our different patients out there over the years have used these different peptides. And they've gotten great results. Another one was Crohn's disease. That was another one. There was a different one. And they've used glutathione along with that too as well. So there's some different things out there that you can use these different therapies or peptides, healing peptides, to maybe benefit you guys or get the result you guys are looking for with hopefully not having to do surgery or some of these other medical things that you might have to do. So check into the healing package. It's discounted, right? So check it out. And I want you to call in. You guys can call in for the discount. Make sure you say Titan Talk. That's the code that you guys got to use to get the discount on the therapy package. You do not need blood work for the healing package. All you have to do is fill out the new patient paperwork. You can do that online. You can print it out and fill it out, fax it back, send it back, whatever you guys want to do. And at that point, you're going to send it in to us. We're going to receive it, and we can get you scheduled. You're going to talk to a medical provider, go over health history, family history, your goals or what you're trying to achieve, and talk about this therapy and maybe some of our other therapies if you're interested in those. At that point, you guys can order the therapy package, and you're good to go. Hopefully, you're on the road to recovery and feeling better and working 100%. That's why I want to get back. Like right now, like I'm in the gym, and I'm being very, very careful about what I'm doing because I don't want to hurt myself more. I don't want to take myself completely out of the game, trying to build back muscle after COVID-19 and all that garbage. So at that point, I want to make sure I'm trying to do it right. But if I do this therapy for 6 to 12 weeks, and that's where I'm looking at, after 12 weeks, when I do another MRI, I want to see where that tear is at. Maybe, hopefully it'll be healed. We don't know yet. But at that point, I'm going to show you guys my results, and we'll see how good it goes. But if you guys are interested in the healing package, all you guys got to do is call or text 727-389-3220 and tell them Titan Talk sent you over there, and you guys will get the discount, right? The healing package, the ultimate healing package. All right, so let's move on. Now, this one was really cool when I read this article. It was about T cell being the key to COVID immunity long term. Now, you guys might have heard me say T cells before, and I've talked about what T cells are and augmenting T cells, or increasing T cells. And there's an awesome therapy that we offer that increases T cells in the body, killer cells and helper cells. And this therapy is thymosin alpha 1. It's also a peptide therapy. This one is commercially available too as Zanaxin. So at that point, thymosin alpha 1 increases T cell augmentation. It increases all these little T cells. So think about all these little cops or military people in your body attacking these cells, bad cells, bacteria cells, virus cells, and just trying to eradicate them so the helper cells come along behind it. But let's get back into what I was originally going to talk about. T cell being the key to immunity for COVID-19, hopefully. So they've done a lot of research, obviously, on COVID-19 and patients and blood and all this good stuff, and trying to find out, A, do we have immunity to COVID-19 once we have got COVID-19, whether it was a little bit or a lot, okay? And then they also want to see how long is it going to last, and does everybody get this immunity? So some pretty cool and interesting facts came out in this study. Really, really cool stuff here, guys. This is cutting edge. So at this point, they know that if you catch COVID-19, you're going to more than likely get antibodies. And you can test for these antibodies through blood, right? And we can test them if you need it. So if you caught COVID-19, you might have these antibodies, and you most likely do. I've got the antibodies. Sharice has the antibodies. My son has the antibodies. Everybody that I know has caught COVID-19 has got the antibodies. Now, the big thing about this is that I was asymptomatic. Like Sharice, she was in the hospital in ICU. Two totally different stories, but we both got the antibodies. So she might have had more of a viral load than I did of COVID-19. So with this, really cool. So we know that immunity is going to be there for, and they say a couple months right now. They haven't put a number on it or exactly how long in months or years and such. Now, some viruses, once we create immunity to them, we're good for a long lasting of years. Maybe a year, maybe 2 years. It just depends. So with the antibodies, if the antibodies go away, you have multiple layers to your immune system. And that's what we forget to talk about. And these other layers, like white blood cells, which increase with infection, also T cells. Now, T cells are really, really cool. And let me tell you why. T cells, once they take over and they eradicate a cell in the virus, they actually take a snapshot of this virus. Think about that. So they have a map of how this virus is made from the inside out. Let's put it like that. And what it can do is it attacks these cells and already knows the roadmap of how to defeat them. It already has the cheat code. So it just eradicates them or doesn't let them come in the body at that point. Really, really cool stuff. Now, another thing is cross-activity with T cells. You're like, what's cross-activity? So they've done research as well on people that have not caught COVID-19 but still have T cells that can defeat COVID-19. You're asking, how is that? And so did I. I'm like, wow, this is really weird. You know, where they buy people just a lot and just didn't catch her. Their immune system was just that strong. No, coronavirus or COVID-19, actually, it came from, and it has a wide family of different coronaviruses. And you might have caught these different coronaviruses along with the common cold. That is where the memory in your T cells might have come from. And it was just really, really cool when you start reading about this. And the different things these memory T cells can do. So we want to increase T cell augmentation. That means increase more T cells in the body to fight whatever's going on or be a preventative to what you have not caught. I'm not talking about COVID-19 in particular. It might be able to help. I know a lot of her patients. I know Cherise took it. It helped her for sure. But with these different things that are out there, these different infections, different viruses, you want to make sure your immune system is at its all-time highest peak. It is working and dialed in, ready to go. That means if your body or you come into contact with something like that, it's going to help you defeat it, get over it quicker, or hopefully you won't get it. So thymosin alpha 1 is the therapy that increases T cells, killer cells, helper cells. There are two different T cells there. So those are different types of cells. Check them out, thymosin alpha 1. What's up, Jose? Big shout out to Jose. We've got the Iron Bay Classic coming up real quick. September 12th. Mark it down in your books. We're starting early, and we're hopefully ending early this year, which is a big, big plus. So shout out to that. More information to come. I'm going to possibly bring Jose on for a video here soon, so you guys will get that. So check it out. Iron Bay Classic, you guys are in Tampa. Check it out. All right, so weight loss survey, this was another research-based thing for weight loss and diabetes. Okay, so this research, it studied metabolic effect on patients. Two different types of patients. One that had the gastro bypass surgery, and the second one that lost the weight by a low-calorie restricted diet. Now, these participants lost over 18% of their total body weight. It's a lot, right? You don't think of it like that. You're like, 18%, that's really not that bad, because if I'm 100 pounds, I lose 18 pounds, right? So, at that point, you're 82 pounds. Now you think of it like that. So you might be losing. So you're going to be losing a lot of weight here. Think of your 300 pounds, okay? Right. But there's people out there who have done it. There's people out there who have lost 100 pounds. I mean, we've got Titans that have lost massive amounts of weight. So it's not impossible. But the difference between these studies was the effect on the metabolic metabolism, basically. How was it revved? How was it going? With two different things. So with the bypass surgery, obviously you know how that is. They go in there, you basically got half your stomach, and at that point it treats your stomach. So most people can't eat as much, or and then they see they're full. So at that point they don't want to eat anymore, so they lose weight like that. And the other one is by them actually dieting and not doing a surgery. So with type 2 diabetes, with the weight loss surgery, most patients, or a lot of patients, I got to be careful what I'm saying here. A lot of patients have actually got off medications for type 2 diabetes. Their LDL, HDL has been better. Overall, better health from having this surgery. So that's a big, big plus, right? Because weight gain, diabetes type 2, diabetes in general, these things are an extreme high amount of people these days. So it's astronomical. I mean, you think about it, almost 50% of the population is in these categories. That's 1 out of 2. That means if me and Art in this room, one of us should be in that category as far as the odds go, right? Which is kind of crazy. So especially when you get a big crowd, think of it, 50% of that crowd, 50% of a ballpark or football field or whatever it is, with non-spacing, okay? I'm talking about all together, no social distancing. But it's just crazy. So with these, they both had the exact same effect. They were both very good on the metabolism. Now, you would think that the person on a low-calorie diet might have a better metabolism because they've trained their body like that. Whereas the person with the surgery gets the surgery done, it's an immediate instant gratification type deal. Think about it. Now, they produce the same amount of their acid in their body. That's the same amount, but they're half of the space. So at that point, it should be burning through food faster. But same thing, same result as far as that goes. Now, doctors said this. They said it's a lot harder for a person to lose the 18% of the body weight by the low-calorie restricted diet than it is for the weight loss surgery. Well, duh. I mean, that kind of makes sense, right? It's like, all right, so that makes sense. But, it's just crazy. So the other thing that they said was this, and this I don't agree with. They said it's really hard for those people to lose it's hard for a general person, average Joe, to lose the 18% of body weight. I've seen a lot of people do it. So at that point, I think if you're motivated, you've got the right game plan, I think you'll be on the right path to do it. And I think a lot of people can do it. Now, the big thing was this about the diabetes. The big thing was the weight loss. The weight loss was effectively the thing that combined together out of the two that had the positive reflection on these people. So that's the big thing, weight loss. And we talk about it now. We talk about weight loss right now. So weight loss is more important than ever because weight loss causes a whole bunch of these different health ailments that a lot of people are suffering from. And they got to take a lot of medication to try to balance these out, which are taking other medications to balance those medications out. But the big thing is to probably increase exercise and their nutritional education so they can eat the right foods, eat the right portions, and exercise the right way to get the weight off. And when the weight comes off, you're going to have less health ailments. And that's what they've seen with both the surgery and the restrictive diet, which is awesome. And like I'm saying right now, if you have these different health ailments, you're in a higher category to catch COVID-19 as far as badly. Now, I don't agree with that either because Charisse was healthy. She got it really bad. I know a couple other people that have got it really bad that were very active people. So I don't know if I agree with it all the way, but we do know that if you have another health ailment, you're going to just add COVID-19 or these other infections on top of that. Think about it before. People have died from the flu, the regular flu, general flu, year to year. So we have deaths from that. So other things can kill you. It's not just going to be COVID-19. And you have these different health elements, diabetes, right? Geez, oh, Pete. You're obese. Your blood pressure is high. You got cardiovascular disease. I mean, the things just keep going on and on and on. And these are just other dominoes lining up. And when one domino gets knocked down, it's going to start hitting those other dominoes and knocking those down too, which is not good for you guys. So please, guys, please, now's the time. Take your health. Don't take it for granted. Do something. If you're out there, help other people. Spread the knowledge, right? Spread the education if you have it. Please do the right thing. So make sure you guys are focusing in on weight loss. And if you guys are looking for any weight loss therapies, we can help you out here in a number of different therapies. All you got to do is call or text 727-389-3220, which leads me into my next topic. And this isn't a story or anything like that. This is just for me personally. So anything's possible. I heard somebody say to me the other day, like, that's impossible. I don't agree with that at all. Anything is possible, good and bad. Because I've seen good and bad things I thought were impossible become possible or be done. I mean, even think about like us right now. So did you ever think that 2020 was going to be the year of the mask? No, right? That's impossible. There's no way that's going to happen. We never even thought this was even going to be coming like this. And what happens? We got these masks. It's crazy. Weight loss. That's impossible for me to eat like that, John. I can't eat like that. Yeah, you can. Do you want to? That's a whole different point, right? So you got to take that in consideration. Are you saying it's impossible because you don't want to put in the effort, or you don't have the mind to think like, I can do this? Whatever it may be, always think that anything is possible, good and bad. So make sure you guys just take that. Just a little tidbit, man. I just like, listen. You guys gotta have the confidence to think it's possible first. I tell my son that all the time. I can't do that. It's another one. I can't do that. Yeah, you can. You can do it. Trust me. Okay. There's been people before you that can do it. You can do it too. So that's what it is. Make it possible for you to do. All right. Just a little tidbit. All right. Walmart COVID hugger on the loose. Yeah, you heard me right. Walmart COVID hugger is on the loose. Now, this is pretty crazy, too. So, in Massachusetts, there was a guy walking around Walmart, going up to people, taking the item out of their hand if they had an item in their hand, hugging them, and just telling them, you just got a COVID hug. You just got COVID. And then walking away. So, at this point, they are looking for this guy. Now, what they're going to charge him with is kind of crazy. They're going to charge him with terroristic threats, because even if he didn't have COVID-19, making a threat to somebody that could cause bodily injury or detrimental to their health in some way, shape, or form, I guess, that's a terroristic threat. Plus, they're going after this guy for assault. Now, all right, one charge, I understand. The other charge, assault, like, this guy didn't hit somebody. He didn't touch somebody as far as that goes. So they're going to get him on assault and terroristic threats when they do find him, which is going to be there's some harsh charges. All right, there's a lot of these terroristic threat charges I've seen people getting slapped with these days. They're thrown around like candy. There was another story that I'll talk about too. I might as well because it goes right hand in hand with this. It happened right here in Florida, if you can believe that. So this old guy standing in line here at a Publix, which is like a supermarket here in Florida. And at that point, he's got his mask on. I guess this guy's like, he survived from heart attacks and stuff like that. And he has his mask on, and he's social distanced at the line. And some girl is in back of him and not social distanced. So he asked the girl, please, can you social distance from me? He doesn't give her a reason, but he tells her that. She does, right? And at that point, they go outside. I guess the girl tells her boyfriend, husband, whoever the guy is. And the guy gets out of the car, and this dude's 70 years old, the guy in the Publix. So the guy gets out of the car, and this guy, like, I guess what they say, like, basically punched him in the chest. And the guy went down to the ground. He's like, if you get up or you say anything, I'm going to kill you. So at that point, like, that's a little bit worse, I think, than what the guy that COVID hugs did. But they're going after this guy for assault, too, that punched the guy. So it's just crazy. Just really, really nuts how things are going down right now. Just really, really nuts. So watch yourselves out there. Head on the swivel at all times. Make sure you guys know what you guys are getting into when you walk in the door somewhere and the environment around you. Because trust me, it is crazy out there, let me tell you. And you're going to have to basically start defending yourselves. I seen Pat Russo, who's a state trooper in Pennsylvania, and I seen his post today, and it really kind of hit home. He's like, what degree would you go to defend your family or loved ones that you're looking at or being around? And at that point, you better, ask yourself this question and prepare. Because at this point, even the police can't help you in some instances. I seen some cops that we were talking about in New York that if they seen somebody run down the street and they snatch a purse from a lady or an old person, whatever it is, right, that they're going to let the person go. Like, they're not even going to deal with it. Straight up. Like, these are real cops. Not even going to deal with it. Just going to let them go. Unless there's any violence, maybe. Those little crimes, they're basically letting go. And that's not like a little crime. Like, you lose your purse as a girl, that's like everything you got in there probably. Charisse is like, geez, oh, Pete. You could probably move into a house with that thing. So, it's crazy the world we live in and what we're going through right now. So hopefully it gets better. All right. UVC wands or lights, good or bad? And it's an ultraviolet light. That's what it is if you guys don't know what a UVC is. So UVCs, good or bad? So UVCs can be good because they can eradicate viruses and bacteria and stuff like that. They're pretty effective, right? With coronavirus, they don't know, but they've got emergency use for this thing, I guess. And a lot of people are using it commercially. I've seen some airlines are using it. Businesses are using it and stuff like that. So it's good for that, right? It does work. But the bad things, and this is for consumer use, home use, is UV lights are carcinogen. It's carcinogens, okay? So carcinogenic. So they're actually bad for you. Some of the old UVCs were made from mercury. You can get mercury poisoning. That's serious too. So at that point, we don't want to do that. The other thing is this, is that UV light can damage eyes and skin, right? And you might not even know it. So when you're using this, and there's not no safety switch, right? There's no childproof switch on some of these things. So if you're using it at home and you're getting close, and you might be hitting your skin, you might not notice the burns on your skin for a few days or the damage to your eyes. Now this can be permanent too, in your eyes especially. You don't want this to happen. So they're putting big warnings out there for people that are using these things at home or not placing them correctly in businesses, that these can actually cause damage and can cause your body harm. Carcinogens especially. We do not want carcinogenics or carcinogens in our body or around us. So make sure you guys are doing the right thing and doing your research on these products out there so you're not potentially harming yourself, your loved ones, or potential customers or patients walking through the door. Luckily, I don't have to deal with that. We pay a company that does this disinfectant spray, ion boost spray, and like basically you can't catch viruses or bacteria on surfaces that you touch for 60 days. Really, really cool stuff. There's a lot of different awesome technology and tech coming out, especially for COVID-19, especially with everything that's got going on. So technology is going to be keep blasting forward. If you've looked at the stock market or you don't know anything about the stock market, generally all these tech companies are on a rise right now. Google, Apple, the ones that basically for electronic signature. There's just a whole bunch of companies tech-wise, Amazon, all these online. Which Amazon, there might be in some trouble. I've seen there might be some trouble with merchants. So they're trying to file a class action lawsuit against Amazon. I believe it's in California. It's in one of the states. So what happened was that during this pandemic, they said that Amazon was using the data from their merchants to go after the clients or go after the consumers. So at that point, if they have your data, they know where your product is, they know exactly the keyword, they know how to put it over the product. That's what Amazon does. It's pretty crazy out there, guys. So at that point, like I said, keep your head on a swivel. So let's get down to the poll question, right? It's time for the poll question. Did you know that you can inject peptides to heal injuries faster, right? Total responses, we got yes, 72% said yes. Wow, so a lot of people are educated about peptides out there. No, can you tell me more? 27%. So obviously, a good majority know that you can inject peptides for healing. BPC-157 TB-500, those are the ones primary that we use. The other 27%, yes, it's out there. Now, there's a lot of places online you look, and you got to watch out there. I'm actually going to talk to a journalist about this tomorrow. They're going to do an interview and talk about BPC and TB-500 specifically. So at that point, you got to watch out. Now, if you go online and you write in BPC-157 or TB-500, what's going to happen is you're going to get a whole bunch of places selling this stuff. Now, what do you have to look for on those places? A lot of those places are selling for research only, even though they might have a video on there of some guy using it or telling you how to use it. So at that point, even on the bottle, it says for no human consumption, not for human use, or they're used for animals, right? So it's sold for veterinarians, but people are buying it for like that. One thing is you really don't know when those are coming from. They're not real pharmaceutical companies selling those items, so you don't know where, even if it has the prettiest label, packaging looks ridiculous, you guys got to watch out. So watch out for that specifically. They're selling it real cheap because it's probably not tested. When a real pharmacy has to send compounds in to get tested, these items have to be tested. It costs some money to do, and that's why the price is going to be more expensive than somebody online selling it for non-human use. Okay? So just be careful out there of what you guys are taking, because if you guys are going to inject this, especially, you're going to inject it into your body. You have no idea where it comes from. So be careful, be safe, keep that head on a swivel, even online. Make sure you guys are researching for sure. All right? Definitely, especially online. A lot of misinformation, a lot of bad stuff out there, a lot of shady characters out there. Be careful. All right, guys. That's Titan Talk. Tagging people at Instagram for this, please. Keep it locked to our Facebook and Instagram, Twitter. Make sure you go on YouTube, press subscribe, hit the all notification button so you get the updates for all the great content. Even on Facebook and Instagram, you guys can hit the notification, the little tri dots, and get